Typically, even highly sensitive patients only have limited reactions on skin contact. There's a study that looks at about 200 or so patients who are skin pick positive to peanut, and they slathered on some peanut butter on their skin, and only about 41% had an urticaria type reaction, and there were no systemic reactions in this group. Smell. This is a neat study. They took 30 children with a history of severe peanut allergy, some of the most exquisitely allergic patients you'll find. And they put a 6 square inch area of peanut butter 12 inches from their face and held it there for a few minutes. They had a control group which was sunflower butter, and they covered the product with cheesecloth so they couldn't really see the difference. It smells pretty similar too. There were no reactions in the experiment group. There was one reaction in the control group, and it was later found to be vocal cord dysfunction from anxiety, kind of like Dr. Metz was talking about earlier. So why is that? Well, most of the smell is actually from volatile organic compounds, and so there's no protein in that, and so you can't really react to it. You can be fearful of it and have a psychosomatic reaction. Aerosolized foods, though, can cause symptoms, and to really aerosolize a food, you have to be intensely working it, so boiling it or frying it, grating it or shredding or grinding. So, there is that theoretical risk of maybe, say, an asthmatic reaction where they're doing a fish fry or something like that. But that risk is low, but possible. What about interpersonal contact? So kissing. A study in the United States looking at a little bit over 300 patients asked them if they'd ever had a reaction from kissing somebody, and about 5% reported a reaction. Similar study in Denmark found about a 16% rate, so either they're more allergic or they know something there that we don't. How long should I avoid my partner? Well, this is an interesting question, and this is an elegant study. They looked at saliva for ARA-H1. It's one of the major peanut allergens after somebody ingests peanut. And after about an hour, only 13% had detectable levels. And by 2 hours, none were detectable, so you got to wait about 2 hours. Brushing teeth or chewing gum actually did no better than time alone. It really is just time for the enzymes to degrade the protein.